Hello there, my name is Batul Tajdar, and this is my case study presentation. Julie E. Jacobs is the conductor and writer of this study. She called it Real-Life Roleplay, a cognitive therapy study with two young sex abuse survivors. Taking a more in-depth look into the case, there are two girls, Jamila, a 10-year-old, and Shantira, a 15-year-old. Both girls are rape victims. Shantira was raped by her mother's boyfriend for about 2 years or more, and Jamila raped by her father for 18 months. Although there are two girls in the study, we're going to focus on Shantira, who was an African American from rural Southeast America. She had been raped before at the age of 5 by her babysitter, and many years later raped again by her mother's boyfriend, who then committed suicide after being exposed, leaving her with a ton of guilt. Looking deeper into Shantira's life, she had an alcoholic, abusive drug user for a mother, who lost custody of the children, which resulted in Shantira being put into foster care. Her foster parents noticed that Shantira's behavior was off and recommended therapy for her. Following her rape, Shantira stopped behaving like a typical girl would. She began dressing more like a man and even started behaving like one, putting a tougher exterior, and eventually she was sent to juvie for assault because she violently attempted to rape another girl. There are many normal and abnormal aspects to this case. One of the normal aspects is the automatic responses that Shantira has to her assailant's death. Shantira was conditioned to believe that it was her fault that her mother's boyfriend committed suicide, so it was only natural for her to elicit feelings of guilt even though she wasn't responsible for it. Another normal aspect was the risk factor. The risk factor being Shantira's mother's drug and alcohol abuse. Although this is abnormal behavior for a mother, the result of her behavior of Shantira being raped was normal. Shantira's mother's behavior was extremely abnormal for most parents. She allowed her daughter to feel guilty and even blamed Shantira for the boyfriend's death. Her parenting styles of neglect was a big reason for why the things that happened to Shantira did. While in therapy, Shantira was diagnosed with PTSD, post-traumatic stress disorder, a mental disorder which can occur after an individual witnesses or experiences a traumatic event. This can include a death, a car accident, a natural disaster, a sexual assault, or any other type of assault. In the DSM, PTSD is described as being possible even when one has or has not personally experienced a certain event. This means that the news of something tragic can make someone suffer from PTSD just as much as actually experiencing something firsthand can. There were 3 types of therapies that Shantira had to go through. The first being cognitive homeworks, which she didn't really do. The second was role-play between Jacobs and Shantira, where she pretended to be Oprah interviewing Shantira. And the last type of therapy was a joint therapy session for Shantira and Jamila. Shantira's therapy really allowed for her to open up and share her feelings about everything that had taken place in her life. The best thing for her was the role-playing therapy, in which she confided a lot in Jacobs. Slowly throughout these sessions, Shantira was starting to progress into school and do much better. She began getting better grades as well. Due to therapy, Shantira wanted to be the better version of herself. The group therapy was also beneficial because Shantira was able to see that she was not alone. She opened up to Jamila and even gave her pointers on how to deal with what had happened. Shantira learned how to trust someone else with their traumatic event and decided that she wanted to help other girls like her. Overall, Shantira was proud of herself for being able to positively influence Jamila. She didn't feel like she needed any therapy because she didn't have anything else to sort through for a while. So she decided to focus on school and a new relationship. She would then continue to apply to colleges and hopefully finish the rest of her education. I believe Jacob's approach to dealing with these two girls was great. She took 2 different girls with the same situation and treated them alone before introducing them to each other, which was a smarter idea. Jamila and Shantira meeting allowed for them to understand that they are not alone, and it provoked the idea that they're not to blame. All in all, this study was a success. Thank you for watching my video case presentation.